This is Michaela Chandra, and this is my head-to-toe assessment. I will use the hand sanitizer to clean my hand. Okay. Good afternoon, sir. I'm Michaela, and I'm here to perform a head-to-toe assessment. I will check your lungs, skin, heart, and nails and legs for today. Can you tell me your name and date of birth?
Luke Chandra, December 6, 1990.
Can you tell me where you are?
Yes, I'm at home.
Okay, that's good. So right now, I'm checking his skin, overall skin. Overall skin looks appropriate with ethnicity. There's no jaundice or pallor cyanosis visible. I'm gonna check his skin. While I'm checking, I don't see any lesions present. And then I'm gonna open this up to check his skin turgor. I'm gonna pinch here. Okay, it came back. Temperature, I'm gonna do this. Good, it's warm, and I'm gonna do it too on the legs. Warm temperature. Okay, and his skin is moist. Can I look at your fingertips? I'm gonna pinch it to look for cap refill, and it's less than 2 seconds. On the toes, it's good. Toes, let me pinch it. Okay, that's good. Then I'm gonna shine a light on your eyes. Look straight. Pupils are equal, round, 2 mm constricted, reactive to light. And let me know when you see my pen light.
Yep, 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 yep.
All right, that's good. And then I'm gonna look inside his nose. Nose is pink and moist. Can you open your mouth, please? Okay, mouth is pink and moist. I'll look inside his ears. Pull the peanut up. Oops, sorry. Okay. Tympanic membrane is shiny and translucent with the presence of light reflex. Okay, that's good. Then I'm gonna palpate his lymph nodes. Okay, no lymph nodes palpable. After that, his lymph nodes, I will look on his chest while he's normally breathing. No hips, no lips present. I'm gonna listen on his heart. I'm gonna listen to his aortic area. Listen to his pulmonic area, to the herb, tricuspid, and the mitral. Okay, with that, I'm gonna get my watch. Okay, with my watch, I'm going to listen to his mitral area and count his apical pulse. I counted 56. Then I'm going to listen to his heart with the use of my bell. Aortic, pulmonic, herbs, tricuspid, and the mitral area. Okay, so now I'm going to check his radial pulse. 2 plus, 2 plus, bilaterally strong. I'm going to put this on him. Okay, so I'm going to get his blood pressure. So blood pressure is 123/73 with a pulse of 55. Thank you. Okay. Now I'm going to check on his carotid artery. And strong bilaterally. Now I'm going to listen to his lungs. Anterior. I'll open this for a little bit. Deep breath, please. Deep breath. Deep breath. Okay. As I'm doing that, I'm looking at his chest tube, and there's no lesion, there's no pigmentation, no rashes present. So with the heart sounds, I identified and heard S1 and S2, no murmurs, no S3 and S4. With the lung sounds, anterior areas are clear. So now I'm going to go to the back side of the lungs. Can you sit down, please? Thank you. Okay, deep breath, please. Thank you. lung sounds at the back are clear. And now I'm going to check the the symmetry. Take a deep breath, please. Okay. It's symmetrical, and while he's at the back, the spine is straight, no skeletal deformities, no scoliosis, kyphosis, or lordosis, head erect. So now we're gonna go to the bed and lay down, or you just gonna go here.
What?
To lay down to check on your stomach.
Right here?
Yeah. Or there, no.
Why?
So now I'm doing his abdomen to lower extremities. First, I'm gonna open this and look at the symmetry and contour of his stomach. So it's flat and symmetrical. Now I'm going to listen to his abdomen. Bowel sounds are normal, not hypoactive, not hyperactive. I'm going to do my light palpation. No muscle guarding and no tenderness. I'm going to do my deep palpation. Do you have any tenderness when I touch? Okay. So with deep palpation, no muscle guarding, no tenderness, and no mass present, no organomegaly present, and the skin, no discoloration and no lesions present. So I'm going to cover this up. And with the umbilicus, it's midline and inverted, and there's no inflammation noted and no hernia noted. And I didn't see any pulsation that is visible. Okay. So now I'm going to check on his legs. So here, the lower extremities are equally distributed. Capri fill, I'm going to check again. Prompt and push against my hand. Plantar flexion is good. Push against my hand. Plantar flexion is good. Dorsalis pedis. 2+ is strong. 2+ is strong. And can you grip my arm, my fingers? Okay. Hand grips are good. And that ends my head to toe assessment. Thank you. So for my head to toe assessment, Mr. Luke Chandra is awake and oriented with his name, place, time, and date. And overall, his skin color is appropriate with his ethnicity. His skin is warm, dry, intact, and no edema present. When I touched his pre-tibial, there was no edema that I felt, and no rash, lesions, and normal hair distribution is present on his extremities. Good skin turgor, no clubbing on the nails, no biting, signs of biting, no discolorations of the nails. Nail beds are firm and pink. Cap refill on fingers and toes are less than 2 seconds. For his eyes, he is not wearing any corrective lenses. Pupils are reactive to light and constricted and equal bilaterally. Scleras are white. No signs of jaundice, no lesions or redness, no nystagmus or no strabismus. Conjunctiva is clear. Corneal light reflex symmetric. Mucous membranes are pink and moist. No lesions noted. And for his ears, the tympanic membrane is shiny, translucent, pearly gray with a light reflex. Whisper word test is good. Hearing is intact. Radial pulses 2 plus is strong bilaterally. Dorsalis pedis strong 2 plus equal. And no edema present on pretibial. And no pulsation and no visible heaves or lifts on the heart or on the chest. Rhythm was regular on the aortic area, pulmonic area, Erb's point, tricuspid area, and mitral area. Identified and heard S1 and S2. No murmurs, no S3 and S4. For thorax and lungs, lung expansion is symmetrical. AP is less than transverse. Appropriate skin color, no lesions, no skeletal deformities. Clear lung sounds, absent or no adventitious breath, like no wheezing, no rales, no ronchi heard upon auscultation. Abdomen, his abdomen is symmetrical. No visible bulging or mass present. Skin color is appropriate with ethnicity. No lesions, no rashes, no pulsation, no inflammation or no hernia. Umbilicus is midline and inverted. Normal bowel sounds upon auscultation in 4 quadrants. It's not hypoactive and it's not hyperactive. And upon light palpation and depulpation, there was no muscle guarding, no tenderness, and no masses and no organomegaly present. His spine is straight, head erect, firm, no muscle spasm or tenderness, no scoliosis, no kyphosis, no lordosis, and hand grip is 5 plus strength, plantar flexion 5 plus strength. Thank you so much.